successful treatment?
Sure, there are a lot of things. I mean, it is a team approach, actually, as you say. It's a team approach. And so, I think viewing it that way, I think is probably the best thing. It's sort of an attitude. If you're there and you think, here, I'm going to see my doctor and we're a team and we're fighting our tumor together, and think about it that way, that sort of, even just that attitude, I think, is helpful. And I go into the room with my patient thinking, okay, what are we going to do together? And I think that there are other practical things that you can do too. I mean, always have a list of your medications and the size of the tablet, the dosage size of the tablet, and how many you take, and kind of knowing what you're on, so that if something happens, somebody has a seizure, they go in the ER, that the doctor's taking care of you, know what you're taking, making sure that you're careful about compliance with your medication. If you've got a seizure disorder, taking your medication, and, trying to just not do things that might undermine your own success at your treatment. And, it's hard to tell somebody they can never have a glass of wine with dinner. So that's, I don't tell my patients that they can't, but drinking heavily while you're on chemotherapy is probably not the right thing to do. So I think exercising, eating well, balanced meals. I don't know that you have to do things that are really off the bell-shaped curve in regards to difficulty, but I think just living a generally healthy lifestyle and being careful about your medications, and, and thinking about you and your healthcare team. And it's not just your neuro-oncologist. I mean, the nurses in my program are extraordinarily important to the success of that program. So getting to know your neuro-oncology nurses is really important. They're the ones you're on the phone with, and they're the ones that are your day-to-day contact, and they're an important part of your healthcare team. So